Well, when I testified on Capitol Hill on the various forms of healthcare reform legislation moving through the Senate and the House, I noted that these bills were far too complex and they were being rushed in too quick of a manner for anybody to intelligently understand. Unfortunately, that's a sad commentary on Congress and the way this legislation was enacted. Now, I always said that the president never really understood what the bill was doing because he focused on the fact that this bill supposedly would drive down costs, i.e. lower the so-called healthcare cost curve. In fact, the bill never did that, and I think he was ill-advised by many of his advisors when he was told that that's in fact what the legislation did. Now we have subsequent studies done on the legislation, and we're finding out that, well, big surprise, costs continued to rise. So we have a situation of where costs are continuing to rise. That was one of the main conditions under which this legislation was passed. It turns out to be false. We have a situation where people were promised they could keep the plans they currently have if they're happy with it. That turns out not to be true. And for various technical reasons, but important reasons. We are also finding that many of our employer members are thinking about leaving the system because while they had health care plans that fit their employee needs at the time, they will now be forced to construct plans that they cannot afford under the president's legislation. Now the American public is waking up to what is in fact in the legislation. Polls show they don't like it, and we have a situation that's going to be difficult to deal with over the next decade. We and others here at the Chamber are going to try and deal with it as best we can, and we'll move forward depending on what happens in the Supreme Court and, of course, what happens in the next elections.